Now, there are a small set of patients in which that sprain leads to something called chronic ankle instability. Instability of the ankle is when those ligaments fail to heal effectively conservatively, and the treatment options change at that point, right? So a patient that has an unstable ankle, and that would be a patient who had a history of an ankle sprain, maybe 6 months ago, a year, who comes in and says, "Listen, doc, my ankle feels very unstable whenever I'm participating in the sport I want to do. I don't trust it. I'm apprehensive or scared to use it." And on exam, when I see them in the office, I can evaluate that instability clinically, meaning doing different procedure or different maneuvers to assess the stability of that ligament or those ligaments, or in some cases do x-rays that here in the office that can help show whether that ankle truly is unstable or not. In any case, the patient that comes in with instability, with this loose ankle, those patients are less likely to get better with physical therapy. Here we have a mechanical problem. Those ligaments have either been, again, failed to heal, or they healed in a situation in which, I'm going to put the model down here, in which those ligaments have healed with extra slack. You can imagine like a rope that is loose. And what happens is the ankle joint, which again is this up and down joint, is now loose and is moving in a way that is unstable and generates these symptoms of pain and discomfort. Those patients typically respond very well to a surgical treatment, and the surgical treatment varies for ankle instability. In most cases, I can repair directly in a surgical setting through a relatively small incision. Again, I'm going to use the model here, an incision on the outside part of the ankle, taking the torn ligaments and repairing them back down to bone. It's an outpatient surgical procedure. It requires you to be in a cast for roughly 3 weeks, non-weight bearing or on crutches, and then I move that patient to a boot and begin to have them walk, participating in physical therapy at 6 weeks and maybe sports at 8 to 10 weeks. In some cases, it requires a little more of an advanced procedure, in which cases where the patient may have been have an ankle that has been unstable for years, and the ligaments are so loose and of poor quality that I need to bring a graft or some other structural support into that ankle